Aloha kakahiaka kako. Aloha. Mahalo for joining us for Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning. Happy, beautiful Aloha Friday. Just a friendly reminder, today's talk story is being recorded so that you and others may access it in the future. All presentations are available on our YouTube channel simply by searching Hawaii Care Choices. Hawaii Care Choices is also on Facebook, Instagram, and Twitter. So please go ahead, follow, like, share, and give us a shaka or a heart. We would love to hear from you. For those of us joining us on Zoom, the bottom of your screen should look like this. Please follow that green arrow and click on that chat box to say aloha to everyone and let us know where you are joining in from. Today's healthcare talk story will be diving in and discussing the connection between homelessness and health. You may use excuse me, you can ask questions throughout the entire presentation by following that purple arrow or the Q&A box to submit your questions to our panelists. To those of you watching on Facebook Live, thank you for joining us and aloha. Please use your comment box to say aloha to everyone and tell us where you are joining in from. Feel free to chat and question, share your reaction during this whole talk story with us using those reaction buttons. We love to see, again, hearts, thumbs up, care button. Even feel free to share this live video to your friends or family. We are also doing polls today. So for those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you using that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at lopez@hawaiicarechoices.org and I will send you the link. So polling is very simple, and many of you may have done this before. A brain teaser bell will ring. A question will pop up similar to what you see on the screen. Please make the selection you think is best next to that orange arrow and submit your poll right at the bottom next to that green arrow. Just to kick things off and get you guys comfortable, I am going to share an icebreaker. So the question up on your screen is, if you were a dog, which dog would you be? Now our choices are a miniature Frenchie, a pit bull, a husky, or a boy dog. So feel free to put in your answer there. Click the submit button below. Again, friends on Facebook, please let us know, if you were a dog, which dog would you be? We have miniature Frenchie, pit bull, husky, or boy dog. We definitely want to hear from you. So go ahead and put that right in the chat, or excuse me, comment box. All right, I am going to end the poll right here and share our results. So 9% of you said miniature Frenchie, another 9% said pit bull, 27% husky, and 55% of you said boy dog. Awesome. So it was super duper simple and you guys got it. Thank you so much for submitting that in. Sorry, some technical difficulties there. So at this time, I would like to welcome our presenters for today. First, I'd like to introduce Lonnie Weigert, who is striving to raise the awareness about palliative, hospice, and bereavement care in hopes to provide world-class healthcare choices and solutions for all. Please give a warm virtual welcome to Lonnie Weigert. Aloha, Lonnie.
Aloha, Tish. Aloha, everyone. Thank you so much for joining us. Thank you.
Our special guest this morning is Brandee Menino, who is the Chief Executive Officer of Hope Services Hawaii Incorporated and is committing to ending homelessness in Hawaii. With more than 20 years of experience in the nonprofit sector, Brandee has served as a nonprofit administrator, a crisis counselor, an outreach worker, board officer, and advocate. We are also so proud to announce that Brandee will be honored by the Zonta Club of Hilo with the Rose Award of Excellence next Monday. The Zonta Club, of which Brandee is a member, is dedicated to empowering women through service and advocacy. Aloha and welcome, Brandee.
Aloha, thanks for having me.
This morning, Lonnie will talk stories about palliative care, and Brandee will take us behind the scenes into the world of homelessness, explaining why so many live with serious illness. We will also learn the facts and challenges that and the solutions for those who do not have a place to call home. I am so excited for you all to be here on Healthcare Talk Story. And I'd like to ask Brandee, we also have another guest speaker on here. Could you please introduce us?
Yes, thanks for allowing me to bring my partner in when we talk about healthcare. We recently hired Michi Fried. She is a doctor of nursing practitioner. When I asked her what she was doing, I go, hey, but you can prescribe, right? She's like, yeah, APRN, RX. She's very passionate about improving the health outcomes of her patients and the experience. I think that's what most resonates with the both of us. She's a mom and a grandma, just like me. And we're really just here to talk story of what we're so passionate about in our community. Help me welcome Michi.
That is so awesome. Aloha, Michi.
Aloha, and thank you, Brandee. Oh, you always say such kind things.
Awesome. So Brandee or Michi, can you please share the main mission of Hope Services and an overview of the different programs provided?
Sure. Our mission is really to bring life of gospel values of justice, love, compassion, and hope through service, empowerment, and advocacy. And what we really focus on is what you had said earlier, Tish, really here to figure out a way to end homelessness in our community. And we do that through a continuum of programs. We have an outreach program where 9 outreach workers across the island outreach and engage with people who are experiencing homelessness on the streets, in their cars, in the tents. We know that there's in the last 2022 count, there's at least 554 individuals on any given night, and that's part of the challenge is with 9 outreach workers, and I'm preaching to the choir, right? Just our geographic area and trying to locate and engage in such a large land area. But we're really there to connect, provide hope, engage and build trust, offer them services into shelter if that's a pathway that they're interested in. We offer and manage 8 shelters on the island in Pahoa, in Hilo, in Kailua Kona, for men, for women, for couples, and for families with minor children. We're really there to help them get on a pathway to housing. That's the goal, that's the permanency, and then provide supports when they're in housing. And throughout that journey, we're talking story, we're learning kind of what are their needs, what areas they need help with. Is it, from the basics of obtaining their identification, their birth certificate, what are their transportation needs, their education needs, their goals for employment. But our target in the forefronts of our minds is how do we get them into their home, a house, so that they can feel safe, so that they can start to thrive, so they can start to connect with community and reconnect with their family. That's really what we're all about. And we're trying to do that by instilling hope throughout our services.
That is so wonderful. Thank you so much, Brandee. You guys serve such a huge population, but it's so needed in our community. So thank you. Michi, I'd like to ask, could you please share how homelessness affects health?
Sure. So I actually want to have a little bit of a different approach and just say that many factors influence health. So health and self-care are a challenge for anyone, right? All of us face challenges with health. They're the things that we cannot change because they're basically programmed into us. And we'll see symptoms of these things at birth or at a young age. We have things like congenital heart defects, right? There are children we see with asthma or eczema. We see type 1 diabetes. There are some disorders like attention deficit hyperactivity disorder, or schizophrenia, or bipolar. These things are built into us, right? And then we've heard probably a lot, perhaps you've heard a lot about the genes that are known to considerably increase our risk for things like breast cancer or colon cancer, okay? And those, we can't change that. There are the choices that we make. And these are the ones that you probably hear talked about, right? You can change them, you can get healthier. But sometimes that's easy, and most of the time it's not. You've probably heard them as like diet, physical activity, personal hygiene, your sleep routine, your stress levels, alcohol, drug, or tobacco use, your sexual practices. So these are things that we can make choices about and that we have some control, but not always easy. And then there are the social determinants of health, and this might not be familiar to as many people, but when I explained it, I think you're going to understand. These are the factors in the world around us. There are the circumstances in our life into which we are born. So it's how we're raised, the opportunities we had as children and as we grew. It's where we live, work, go to school. What are the resources in our area? And Brandee touched on that, right? We live in a rural area. The geography is so varied. Do we have resources and can we access them? Do we have adequate health care or transportation? And then how much money do we have to meet our basic needs? Everybody has basic needs for food, clothing, safety, and shelter, right? So when we talk about homelessness and health, we need to ask ourselves, where are we at in our lives? Where are people at in their lives? And what brings a person to homelessness? Because all of these things are going to affect health. And so just imagine if you're struggling, if a person is struggling with a job, with a relationship, with a medical condition, and then on top of that, there is homelessness. How much harder can that be? So, for example, I have an older patient and he fell. And now he's in the hospital. He's trying to heal from the complications of this fall. So that's extensive wounds, metabolic abnormalities, a spinal fracture that impacted his neurological function. But he lives alone in a house that has no electricity and no running water. So would we say that he is homeless? Actually, yes, we would. If he's not safe in his home and he has no electricity, no running water, you know, is that a safe place for him to be? He doesn't have family. He doesn't have money to hire people. So what will become of him? So we also think about the people who were displaced and who had losses due to things like tsunami, hurricane, earthquake, and the lava flows, right? So think about these things when you're thinking about homelessness and how the stress, how the need, how the lack of resources would impact your health. And you don't have a home. So
thank you so much, Michi. Yes, definitely. On that, the access to resources, I'd like to ask Alani to share about palliative care as a resource that is in our community. Thanks so much, Michi. Aloha, Lani.
Thank you. And it's really an honor having Mitch join us because she has worked with us at Hawaii Care Choices way back from 2017 in our journey of bringing palliative care to our community. And she's been in the trenches with us for that time and even longer. So I'm really honored to have her join us here because now she's bringing that knowledge right out to the streets and helping so many that because of their environment and situation and all of this other information that she's given us, it's really good to raise our awareness on what homelessness is really about. So I really appreciate that, Michi. Thank you so much for sharing that. I wanted to share with everyone on our presentation this morning about what is palliative care. I think a lot of people are not really clear as to what palliative care is. We don't actually say those words very often unless you have somebody like Mitch that comes over and is checking on you. She might actually say these words to you, but to palliate is to ease, to alleviate, to relieve, and to soothe. And so this is very specialized care, particularly for those who are dealing and living with a serious illness such as any kind of cancer, COPD, CHF, liver, and kidney failure as well, if they're having any kind of treatments, then they're probably gonna be living with some discomfort. And that's exactly what palliative care focuses on. And it's all about boosting the quality of life. For us, we just want people to feel better. I mean, it really comes down to that basic. We just want the patient and the family to feel better. And that's where we come in. And for many who might not even be aware of palliative care is offered to any age. I mean, we could have babies all the way up to kupuna at 107 years old. So our scope is quite large.
Thanks so much, Lonnie, for sharing that. Also a resource in our community. Brandee, is palliative care provided for your clients? And if so, how do they access it?
Yeah, we've worked closely with all the health plans and with the hospital. And I mean, before Michi came on, it was just us, right? Counselors and social workers trying to navigate the health connections and the network. So it's really connecting to the health network, like with the hospital, with the health plans, with their nursing case managers from whether it's Bay Clinic, Hawaii Island Community Health Center, I think it was West Hawaii in the past. It's like really connecting with them and figuring out what is the best path to get them the help that they need. And we did have, I was shared a story, an example by my colleague that one of the residents who were in an apartment that we managed for people with disabilities and were formerly homeless, where they did receive palliative care, and that was coordinated actually by the hospital, which sounds similar to even the situation Michi was talking about, right? So that often happens, right? They're either houseless or in our shelter. They'll get additional care that they need in the hospital. And then from the hospital is really where they help connect them to palliative care.
Thank you so much, Brandee. Back to you, Lonnie.
Thank you. And what's beautiful about all of this is that it really does take a village to, raise up a community. And the fact that the hospital has a palliative care screening tool really allows us to access people all across, East Hawaii as well. And that's why with Hope Services connecting to the hospital, we all stay connected in some way. And that's the beauty of it, as well as, all of the clinics that we work with as well. So for us, we try to really impress upon our families and those are providers out there that early admission is key, because if we're able to come in and help the patient and the families, then their quality of life can actually be changed quite considerably for a very long period of time. We have people that are on palliative care with us, sometimes years. So, these people are still going Vegas and they're still going canoe race and other things like that as well. And the difference, of course, for the homelessness, the homeless clients, is that they have other challenges, particularly trying to get into housing that will affect this as well. But what is important on this palliative care thing, which is really coming to the forefront and people are understanding about it, is that the providers and the physicians are focusing largely on trying to help the patient cure the disease. When the palliative care team comes in, such as us, we're focusing on the whole patient, meaning things like where they live, what are their life goals, what kinds of things are important to them, what are their values, etc. And the reason that we do that is because in working in collaboration with the provider, we want to make sure that whatever treatment the patient gets, it's for the patient's best. So I'll give you an example. We had a person that came on with us, and she was sharing that at 21, she was in school to become a doctor, and she also got married. It was probably one of the most celebratory times in her life. Sadly, she wasn't feeling too good, so she went to the doctor, and she found out that she had cervical cancer. Well, why this was just so devastating. I mean, it's devastating to anyone as soon as you hear the cancer word, because after that, you basically don't hear anything else anyone is saying to you. Well, what happened is, her life partner, her husband, newlywed as well. I mean, he's just learning how to be a newlywed, let alone now he's going to have to learn how to be a caregiver. The other thing too is that she was a very avid athlete as well. And so when she went in and she got diagnosed with cancer, her oncologist said, you know what, we'll schedule you for surgery and we'll go ahead and take that cancer out. Let's schedule you for next week and we'll get this done. Again, like I was saying, the physician is doing the physician's job of focusing on trying to get the cure. Well, because she was studying to be a doctor, she thought, wait, I'm sure there are other options for me other than surgery. I'm feeling scared. I have a lot of anxiety. I'm still young. I haven't had any kids yet. I mean, all of these things that are really, really logical concerns for her. And she happened across a palliative care social worker who she was able then to ask, what do you think I should do? This is my diagnosis. Anyway, the palliative care social worker shared with her first and foremost, what are your life goals? What is important to you? What are your values? And then that's when she said, well, she's an avid athlete. She goes and does marathons. She's a long mile cyclist. She really enjoys that, on and on. And then it was discovered that by having the surgery, she probably would never be a cyclist again. And so you see, that's why together, the provider and palliative care team, how critical that is, because in fact, other treatments were determined for her. And this is a thing that she shared with us, is that if you don't know, you don't know. But there's other things, is that you may get treatment that isn't the right treatment for you. You may get treatment that you can't afford, and you may get treatment that you don't need. So all of those things came into play. And I'm so happy to report that this person did become a doctor. In fact, she is a main advocate for palliative care and is currently pushing it through the state legislature to become law across the state of Hawaii for everyone on MedQuest to be allowed to have palliative care. And so her situation turned out to be a success, and she's also cancer-free. But I'm just saying, that's why palliative care is so important, and most people don't know about it. And when working together with a provider such as Michi, I mean, true miracles could in fact happen.
Thanks so much for sharing that wonderful story, Lonnie. Brandee, we're talking about all these wonderful services that you provide to our community. Could you please tell us, how do your clients pay for the medical services that Hope Services provides?
All the services is at no charge. They're free. And I really wanted to go back to what Lonnie had mentioned, and just the relationship with the hospital. So when we talk about engaging and building trust, that's one area where we know that was key, right? The discharge from the hospital. And we really tried to capture and have enough space in our shelter so that we can make that easier transition and into our shelter, and not have them return back to the streets. So late last year, I want to say in the fall, we did, Hilo Medical Center did contract us out for 4 beds. And the reason why I bring that is, in our minds, we call it medical respite, but it's really short-term housing for the hospital, right? They're transitioning a patient out of the discharge out of the hospital, and then they don't really qualify for additional hospitalization stays, right? They're not eligible. They're well enough to leave, but they're still, you need more time to recover. And that's really what I was reaching out to Michi of, like, hey, Michi, it's just housing we're providing, but I know, like, we can do better in their patient discharge experience. Like, can you help us out, Michi? And so she's really figured it out, like our workflows and, talking story, providers, they talk the same language, right? We have a different language, just as she tells us too. So we're all trying to figure it out. But if we find somebody like Michi who talks their language, then we can put her in the front and like, yeah, Michi, go talk to them because we don't understand. So that's one of the things where we're really proud to be very intentional in having clinical services. And maybe Michi can talk more about that.
Okay, you opened the door, Brandee, because you know how passionate I am about this. I'll try to keep it brief. But yes, the idea is we are comprehensive, holistic people, right? We need help. We are not a person in the hospital or a person on the street or right? We are not just one aspect of who we are. We are a whole person. So when we are having a medical event and we know that we need to heal from that, it's a gradual process. How many of us go from, 0 to 60? I'm not well, I'm well. None of us. So I am really privileged to be a part of this innovative and progressive approach to healthcare for some of our most vulnerable people. Yeah, and so like this gentleman I was speaking of earlier, to really understand his medical journey, but then to also bring in the team, the interdisciplinary team that can help him with the emotional journey, right? With resources, help him feel safe, help him to have the best environment possible in which to heal. So when we have these conversations about what are your goals, he can have goals, right? Because he has support. Whereas before, at least the story that I have, and I have no reason to disbelieve, but that he doesn't have a support system outside. So we will, we'll do our best. We're building resources all the time about understanding his life journey. And that's true for just anybody. You can help people by bringing them knowledge, what we call increasing their health literacy. Yeah. And then we help support them, their confidence, their self-esteem, their ability to make decisions, because we are all independent and unique individuals. We want to be respected. We want our opinions and our decisions to be ours. Okay, so we are here to help them understand what those options are, like palliative care, because Lonnie, woo-woo, I am such a big supporter of hospice, of Hawaii Care Choices. And almost went back to the old name. Sorry. And in fact, I have another story. So we also, I've also worked with a patient who has advanced heart failure. And just understanding that process of, yes, we can give him shelter, but unfortunately with progressive chronic diseases like heart failure, he's not going to heal. Okay, he's not going to get better. And in fact, the stressors of homelessness have been worsening his condition. And he has a child, right, that he's trying to support in a tent on a lot. Okay, so wow, how complex is that? What can Hope Services bring to this situation? And actually, Lonnie, I'm calling you folks. Because what can you bring to this situation, right? Palliative care. So we're definitely going to have some discussions. But it takes a village. It's opening your heart and your mind, being non-judgmental and saying, hey, we all struggle. We all struggle. And there are some things we can change, but there are a lot of things that we cannot, or it's just really hard to do. So those of us who have the opportunity, what can we bring to the people in our community? Because we help one, we help many. Yeah. So I don't know, did I answer the question, Brandee? But yes, the transition of care out of the hospital to us, or maybe they're going to skilled nursing if they have that opportunity, and then they come to us. We can bring in home health, there's wound care, there's physical therapy. We have so many talented, skilled professionals ready to help. And so we're very blessed. Yeah, I'm blessed to be a part of this whole experience.
That is so awesome. Thank you so much, Michi, just for sharing all of these stories. We love hearing them. We also love sharing them as well. I'm going to pause for a moment. We have a quick brain teaser for everyone. So I am launching our first brain teaser up on your screen. Early patient sign up ensures more support and quality of life for all. True or false? Again, for those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you. Feel free to put in your answer right into the comment box. Everyone is welcome to the fully engaged Zoom presentation. You can email me, lopez@hawaiicarechoices.org. You can also visit our website, www.hawaiicarechoices.org/healthcare talk story to join. All right, so I am going to end the polling right there and share the results. So 100% of you said true. Early patient sign up ensures more support and quality of life for all. Michi, I also wanted to just say, I love the idea of the whole person, right? It's a whole person approach. It's not just one singular thing. So thank you for sharing that. I am having technical difficulties again, but back to you, Lonnie.
Thank you. Thank you so much, Tish. And Michi, I want you to call us as often as you can, like even more than you think you need to. Just call us a lot because, girl, it does take a village, you know, and however we can help, we will certainly try. And just the fact that you folks are out there trying your best to lift this entire group of people, I mean, that takes a lot of heart to do that too. So count on us to be right there.
Well, you know, this is going to date me, but you know, I've got that bat phone, right? That direct line.
No, and what's so cute is that you're saying, oh my God, I was going to use the old name. It's like, but that just goes to show like how long you've been in it with us, you know, and that definitely says something for all of the people that are on this call, that it's not a fair weather friend kind of thing. I mean, we are in it for the long term, and that kind of commitment can only happen when we are truly passionate about the work we do. So thank you again, Hope Services, for even being with us on this call. So with regard to the palliative care side, I was just saying that when people are living with serious illnesses such as that's listed on your screen, you know, it really affects their quality of life. And it's largely because the symptoms that they deal with because of the treatments that they're getting, you know, really hinder them, causes them a lot of anxiety. There's chronic pain, there is sleeplessness, nausea, just all kinds of other stuff. And that's why when palliative care comes in, we're able to help educate people about the best way to deal with these symptoms. And that's why it's so cute when Brandee says, she's talking to Michi and says, but you can prescribe, right? I mean, it's because a lot of the people that we're trying to help have really, really difficult pain as well, and just other symptoms that we're trying to help them with. And it takes a lot of education to not only just give them the medicine, but to educate them on the reason you're feeling bad about that is maybe you kind of eat spam every day. You know, maybe we're going to have to cut back, and, you know, maybe you can boil certain things. Just that's what I'm talking about on education, because palliative care is consultative in nature. Like, we're not going into the home, where, by the way, that's where we serve the population, is wherever they call home. So we have been known to go to the tent or even to the side of the road. I mean, we will go wherever they are to service them. But yeah, palliative care is more about education and teaching them versus coming in and doing wound care, which is a higher level of care that we would provide for our patients. But again, when a patient is going through something, if they do have a partner or there is a family, the family is going through all of it as well.
Thank you so much, Lonnie. Michi, I know we were talking about some of the challenges that the folks that or community that you serve faces, but what would you say is the most prevalent health challenge for your clients?
Oh gosh, that's a that's a tough question to answer because I think it's the lack of resources. But when you say lack of resources, I mean, what does that mean? So definitely a safe place to be, right? I just have to go back to our basic needs: food, shelter, clothing, and safety. And if you really think about it, if you don't have a place to live, it is very unlikely that you have the funds to get everything else that you need, right? And it's difficult to access healthcare resources. So, I mean, what are the challenges? The challenges are that you sometimes you feel alone. You are without the resources that you need, and it's difficult to figure out where to start. How do I even start getting some help? And we have to worry about stigma with homelessness, right? So maybe I'm courageous enough to seek some help, but maybe I'm turned away. Maybe people don't understand my situation and can't seem to get to know me better. So that's why I emphasize non-judgmental, open heart, accepting a person, trying to get to know them, who they truly are, where they're truly at, and then how can we help?
Thank you so much, Michi. I do agree there is that stigma, but we want to help as much as we can and provide all the resources that we can for them. So thank you for sharing that. Back to you, Lonnie.
So when we talk about palliative care and where we provide it, we always provide it at home, wherever the person calls home. But it's so important to us to make sure that the patient is at the center of all of it, so that they feel like they have control on what is happening to them. And we do that by creating the goals of care for them, where everybody on the team will know, what kind of treatment they should get, what their diet is going to be, and also understanding the values and priorities of not only them, but anybody that is important to them that may be visiting them or may be living with them, wherever that may be. We find too, with living with a serious illness, many are dealing with a lot of emotional issues as well. Not only trying to manage their pain and symptoms, but emotional where they feel, depressed, isolated, just like Michi was saying. There's a lot of anxiety and all of that. And so it's important for them to have somebody to talk to. And when a palliative care team goes in, they have that ability to just help them along so they don't feel so alone. And it's important to connect them to other resources within the community that they may not know and that are free to these patients. And so it's very important to have that. And when Brandee was saying it's great having Michi because she speaks that talk, oh, we totally get it. Because when our patients go to see their doctor, sometimes our nurse will accompany because, they want to get certain goals done, but they don't know actually how to say it to the doctor. And, they want to be good patients, which means that they're going to go in, they're going to be in there for 7 minutes, and then they're going to get out. And that's because they're not going to ask any questions. They're not going to complain about anything, whatever the situation is, that's what's going to happen. And so it's not going to be a productive or fruitful visit, which is why when you have somebody that can be your advocate and speak up for you, it really makes all the difference in the world.
Thank you so much, Lonnie. Brandee, I would like to ask, what is the largest ethnic group that you are serving, and why do you think that group?
The largest, and sadly, and it shouldn't be a surprise, really, the largest ethnic group is Native Hawaiians. I mean, that in itself, you know why, right? We're displaced in our own lands. So sadly, that's the group. You know, why I stay and why I do this work is this is my way of contributing to still help my people. People are native to my land. I'm privileged that my parents got his Hawaiian homestead land here in Panaeva, you know, but that's not true for most. And we've worked with DHHL. They've actually identified, we share data with them from our database, actually throughout the neighbor islands, and they were able to identify who are still waiting on the list. Yeah. So oftentimes we always hear the, you know, hey, Brian, what you guys doing with all the people coming off the plane? I'm like, dude, that's like 4%, like, of those we served in the last year. The numbers are really low. And it was even lower during COVID when the civil defense, you know, they were, and additional federal resources were kind of managing the airports, right? Like you had to have a plan of a place where you're going to go. So even then, less people was coming. We know that people are coming to our community, but the majority of those we see are experiencing homelessness is people who have been in Hawaii. So not just Native Hawaiians, but people who have been in Hawaii for more than 20 years. So we're really talking about Hawaii residents. That's who we're serving. That's who we're concerned about. Longtime residents of Hawaii.
Well, thank you so much for sharing that. Shocking, but actually not so shocking as well, right? Like you were saying. Oh, thank you. Back to you, Lonnie.
Tita, you're on mute.
Oh, yeah.
Yeah, thank you so much, Brandee, for clarifying who it is that you folks are serving, and that how the misnomers that people will say that, oh, what about all the people coming off the plane and all that? But really, that's not the majority in that. In fact, it's a lot more deep-seated. Anyway, here, our friends at Community First Hawaii, for anyone that is on our presentation that may or may not have a advanced healthcare directive, please connect with our friends here at Community First Hawaii. I mean, they just do an awesome job. And when you or the person leaves, they will have an advanced healthcare directive. So it's really a beautiful thing. And you know what? You can also contact them and they'll come and they'll do a presentation for your group if you have one. So please, if you don't have an advanced healthcare directive, this is probably one of the most valuable gifts that you could give a loved one. Should something happen to you and you be unable to speak for yourself, this is really critical to have an advanced healthcare directive.
Thank you so much, Nadia. I did put the link to register in the chat box. So if you want to go ahead and copy and paste into Google Chrome or Internet Explorer or anything like that, feel free to do so. Or you can put your camera right over that QR code to register as well. Michi, I'd like to ask, do many of your clients have an advanced healthcare directive? And if not, would they be open to getting one at the free presentation?
That's hard to say, but I will say that they better, because it won't be for lack of offering, explaining, requesting. It is one of those things that I think people have to truly understand and warm up to, for lack of a better term, because people equate advanced healthcare directive, and correct me if I'm wrong, Lonnie, but equate it a lot with, does this mean I'm going to die? Yeah. Actually, I recommend it to all ages, especially people with children, because it's so hard for anybody to know what you really want. And this gives you an opportunity to have a voice. So I would say that, yeah, more people are becoming acquainted with advanced healthcare directives. Younger generations, more so than the older generations, are open to it. Older generations tend to believe that if they have family, the family will just make all the decisions. Sometimes it has to do with cultural beliefs, right? And personal perspectives. So but I believe in that advanced healthcare directive. I recommend it to everybody. It's free. And I think once you learn about it, you will understand that it's just one of the best things that you can do for yourself and your family.
Thank you so much, Michi. I absolutely agree. It's the best thing that you could do for your family. It truly is a gift. Back to you, Lonnie.
So, the true Cadillac of services is hospice care. So when people are in palliative care and as time goes on, they may need a higher level of care. Within the palliative care umbrella is a subset, and it's called hospice care. It is a very specific type of care, and it's provided to those who are terminally ill, have a prognosis of 6 months or less to live, and are living at the end of life. And so the hospice care, to me, I always call it the Cadillac of services, because it's a very robust program that really provides a lot for the patient and mostly for the family, which is why it's so sad to me when somebody will say, and this has happened over generations, where they'll say, oh, no, don't call hospice yet, because mom's still eating. Like, let's wait till she's further gone. And this is the thing is, I think people would had the idea that hospice would come in and actually hasten the loved one's death, or even cause it, in some way. But there's nothing more further from the truth than that, because we found that oftentimes when people call us to qualify for hospice early, many times, they graduate off the service. And we had, I think one of the patients that we had, the longest time that we had that patient was over 7 years. And that's where the patient comes in after a couple of months, is actually thriving, so graduates off the services, and then maybe 6 months later they come back on. And I mean, like, that kept going there for quite a while. And the reason I feel that happens is because of the intentioned, compassionate care that they receive actually makes them better. And largely it's because a person is not living with so much stress that really activates and exasperates the illness even more. Often it's the dis-ease that is causing them to feel so uncomfortable and continues to progress in their disease. So anyway, it's just really important to know that when people don't have a physician's background, you can still see physically when somebody is going through changes. Like, the person doesn't want to eat, or doesn't really want to drink anything, is in bed most of the time, has a difficulty just even getting out of a chair, has difficulty bathing themselves, can't make any food for themselves, they no longer drive. I mean, there's just real specific physical things that tell you that this person probably needs a lot more care at home. And then for physicians, when I tell them that, are they offering this care to their patients? One of the physicians would tell me, oh, well, yeah, he has, but the patient doesn't want it. And I said, well, how does the patient's caregiver look? He says, oh, yeah, she looks really frail. I said, well, ask the patient, how is he going to survive without his caregiver? And sure enough, once he asks the patient and the patient says, oh, I don't need that because I have my wife, she's over here taking care of me. It's like, yeah, but how will you do if your wife's not there? Oh, no. Okay, yeah, we go sign up then. Okay, because that's the reality. A lot of times people think that they're signing up for hospice just for the patient, but no, it's the boatload of support that the family is going to get, and that should not be held back till the last 7 days of a person's life. I mean, it's difficult for us to come in at that point and really uplift the family with only 7 days. But can you imagine if we had 7 months the family would be a lot more resilient when the patient becomes imminent and is ready to pass.
Thank you for sharing that, Lonnie. Michi, I have a question for you. Earlier in the presentation, Brandee was mentioning a goal is to have housing assignments for a lot of your clients. My question is, if your client is still waiting for the housing assignment or maybe a placement, how do they receive the follow-up care since they don't have a set address?
It's really important for us to create that connection between our clients and their primary care providers. So we can provide limited medical oversight. I'm there to create connections, enhance that health literacy that we're talking about, their understanding, just as Lonnie was talking about, provide that support and interpret a lot, do a lot of interpretation. But ultimately, they have, or they should have, a primary care provider. If they have specialists, we want to create that connection, case managers. So it's a team. And so follow-up then is about coordinating that care. And I cannot underestimate the value, I cannot overestimate the value of our community health workers and our navigators and all of the support team who just do the bulk of that kind of work, making sure that people have what they need, their transportation, their schedules, their scheduled appointments, making sure that they have done their labs and their imaging and all of those things that are connected to their care, but then also making it easier for them to do all of this. I mean, that's really important. So I, as a provider, I can write all kinds of orders all day long. I can prescribe medications and order treatments and, refer people to other providers. But if we don't have that follow-up, right, that you're talking about, that is key, how do I know that any of that is even happening? So follow-up is a multi-step process, multifaceted issue. And it's because it requires, we can't just say, hey, you individual, do this, and then expect that, yeah, they're going to be able to. I teach workshops and nursing students and such, and I always say that people fall on a spectrum. And it's a spectrum of, I need a lot of help, to I'm pretty self-sufficient, but I'm trying to do this within the width of the camera, but really we're talking about, right, that spectrum extends way beyond what the camera can see. And then we have people who fall outside of this spectrum, and those are the exceptions, right? The people who they just need support because they never actually will be able to take care of themselves. And then those who are super self-efficient, who will need very, very little help actually until the time that there is an emergency, a trauma, a big challenge in life. And that happens to all of us. Accidents, that cancer diagnosis that you were talking about, Lonnie. So we pay attention to this majority in the spectrum, and we say, where are you at? I'm going to return to that, right? Where are you at in that spectrum? What do you need? How do you learn best? And I'm going to keep trying. And the other thing is we need to give people chances. It's not a one and done deal. Hey, I explained that to you already. Didn't you get it? Right? You should have gotten it. No, that's why palliative care can go on for 7 years. Mm-hmm. Hospice care can go on for so many years, right? It's because we say life is a roller coaster. Life is not a straight path, whatever analogy you want to use. And in our journey, we're going to have good moments and bad moments. We're going to have more challenges and hopefully a lot of joy. But as we travel that journey, we're going to need more help sometimes than others. And we're going to be open to that help more sometimes than in others.
Thank you so much for explaining that. That is definitely a big spectrum, but I'm glad that you kind of hopefully encompass everyone. Back to you, Lonnie.
So it's really important to get the diagnosis early, and early admission is key. And again, I'm saying that not only for the patient but largely for the family, because when somebody is terminally ill, I mean, the whole family is turned upside down, and to have somebody come in and give emotional as well as physical support means so much to everyone. And that's why, again, I say the hospice benefits are so very robust with regard to the medications, all of the medical equipment, having the patient no longer go to the physical doctor's office, and then having an entire team come into the home or wherever they call home to assist the patient and the family.
And with that, we have another brain teaser that is coming up on your screen. So how is palliative care and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, or all of the above. For those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you using that comment box. Again, feel free to put your answer in. If you'd like to join us on Zoom, visit our website, www.hawaiicarechoices.org, to sign up and register for the fully engaged Zoom presentation. You can also join us on Facebook Live again, and then send this live presentation to your friends and family who may need to hear this awesome information. I'm going to end the poll right there and share the results. So 100% of you said all of the above. Thank you so much in engaging in our polling. My technical difficulty always happens after brain teaser, but here we go. Back to you, Lonnie.
So the short and important part about how these services are paid for, palliative care is specialized care. So it's just like going to see an oncologist or some specialist. There could be a copay depending on if there's only one type of insurance. Maybe it's just Medicare. But if there is Medicare and Medicaid, there won't be a copay at all. And hospice care at home is covered 100% under most insurances, meaning Medicaid, Medicare, HMSA, etc., even VA, Kaiser, whatever the coverage is, most of it is all covered, and that's why it's the Cadillac of all services.
Thank you so much, Lonnie, for letting us know about the secrets of palliative care and how palliative care can help. I just want to thank everyone in our audience for listening in this morning at Healthcare Talk Story. A very special mahalo to our guest, Brandee and Michi, for your value time and your helpful and wonderful perspectives shared on today's talk story. If you have any questions specifically about you or your loved one's situation, please reach out to us. We have a very helpful team standing by that will be so happy to answer any of your questions. You can call us at 969-1733, or you can also email us at care@hawaiicarechoices.org, or ask your doctor if palliative care is right for you. Our hope is that you receive the right care at the right time, and we want to make you feel better. For those of you joining us on Zoom, there will be a quick survey that will pop up on your screen. Please make the selection or best selection possible for all 6 questions, and then click the submit button below. This one is anonymous and it will not be shared. It just gives Lonnie and I feedback on our presentation today and helps us gain better understanding and knowledge for how we can best serve you with presentations like these in the future. Feel free to drop a comment in the comment box to all of our presenters as well, or if you have a last minute question you'd like to share. For those of you on Facebook, please send your thumbs up, your hearts if you enjoyed this presentation, and send a mahalo to our guests. Everyone is invited in next month's Fully Engaged Zoom presentation next month on the 10th at 10. Again, visit us on Facebook, sign up on our website, hawaiicarechoices.org/healthcare talk story, or you can email me at lopez@hawaiicarechoices.org. So that survey should be popping up on your screen right now. And while they're taking their surveys, Brandee, I just like to mahalo you again for giving us your valuable insight, as well as Michi. We're so thankful that you guys took time out of your schedule to join us. And we just made the 11 o'clock hour, but I'd like to ask Brandee, what do you feel is the most common myth that the public assumes about the homeless population?
That everybody's coming off of the plane. I get that everywhere I go. You know, chamber meetings, Rotary meetings, community off of the street. Even though I give the data, the majority of people are here. 60% have lived in Hawaii for more than 20 years. They still go back to the 4% that's coming off of the plane.
Thank you so much. I'd love to dig more deeper in that, but Michi, what do you feel is the common myth that the public assumes about the homeless population?
That somehow homelessness was a choice, that somehow people want to be homeless. No, nobody wants to be homeless. It might be that people want their independence, right? It might be that people enjoy a certain lifestyle, but really, I ask people, when you think about homelessness, we tend to think the negative, we tend to think the worst, but really it's about the struggle. So, you know, we're all in this struggle together, and we're looking for answers. And I think that if everybody could just pause a moment and dig deep, you know, think really about what struggle is. Look at your own lives and the people around you. You realize that we're all in this together.
Thank you so much, Michi. Brandee, one last question. Will respite beds be available in Kona shelters again?
That's our hope. As long as we have capacity, that's always the challenge, right? So a registered nurse that could go out there. Yeah.
Okay, thank you so much. And thank you, audience, for that question. I know we are at 11:02. Lonnie, is there any last words you'd like to share with us this morning?
No, I'm just so very grateful for our guests. Thank you so much, you folks. That was awesome. That was really great. Thank you. And thank you to everyone that joined us. We had such a diverse group of people from different places on the island, both Kona and Hilo. Thank you again for joining us.
Yes, absolutely. And again, we're here on the 10th of every month at 10 o'clock. Tell your friends, families, and loved ones. Mahalo again for joining us on Hawaii Care Choices Healthcare Talk Story. Until next month, ahui ho malamapono. Take care. Aloha.
Aloha.